turn over one end like that so that I can find my end at the end of the treatment. You may find, I can use it anyway, but you might just find you want to cut this in half. But I like mine the full length. Oops, the wrong way around. Just wind it around. And then this little edge that I've left here is really, it just makes it easy for me to take that off at the end rather than trying to find my my end all the time. So now I'm ready to work. But as I said, you can pop a sleeve over here as well. If you don't use the sleeve, just make sure that you use, you know, 100 hospital grade disinfectant to clean your equipment and your cord in between each client. Okay, so now we're ready to go. So the first thing that I do is remove any traces of numbing cream in the area, and I use Prontosan, and the reason that I use Prontosan is because it is a non-alcoholic wound irrigator. So we're ready to do that. So there's the Prontosan. We gently wipe that area. And then I dry also. And now we're ready to work. So just make sure you always wear a mask when you are doing your treatments. You do not want the epithelials. Oops, now I've got 2 masks. I like actually to work with 2 masks to protect myself, so that the skin cells don't get absorbed into your lungs. It's not very healthy for that to happen. And I find that it's always great to work with a good set of magnifiers. I use one that also has a light on the end here because this work is very, very detailed, and I really don't think that you can work without a good set of maggies as well. So we're kind of ready to work now. So I would take the probe. I like to rest on my arm here to support myself. In some instances, you'll find that it's actually easier to use a towel between you and the client. Just roll a towel so that you've got a little bit more support when you're using the machine. And we're kind of ready to go. So all we're doing now is turning our machine on, hit start here, and we're ready to go. And it's as easy as that. As I was saying before, we've got the LED, so if you wanted to work with your LED, just hit the LED button and you'll see the light on, and it will shine onto the client's skin. And then also, if we wanted, we can use the auto. So if you turn your machine here to auto, this is your exposure time. Put your up or down to whatever you want. I was working on 0.4 then, whoops, 0.4, and just hit on. And now you'll see that my machine automatically will run here on auto. So I would just need to hold it and then just move with the flashing red light. If you're not in sync, then you'll find you'll get a bigger burn, and you don't want that. Less is more when we're creating trauma to the skin. And so now we're ready to complete our treatment.